In the 4-year stream, there are 2 placements. So the first placement is 230 hours, and the second placement is 520 hours, a whopping 520 hours. So if you arrive as a pathway student, you are credited. Okay, you are credited that first placement. So you do not need to do that first placement of 230 hours. The placement for 520 hours is you cannot PLAR it for the exact same reason that Julie indicated. Within the Bachelor of Child and Youth Care, we're asking you to take some of what you've learned in your research methodologies in your first year. In your first year with us through Pathway, you have a disability course, you have a sex and sexuality course, you have a race and racism course, and we want you to take some of that information and take opportunities that arise in your placements and apply it there. So the second placement is 520 hours. It's scheduled for the summer. So our framework is called Work Integrated Learning. So you come to us in September or January, depending on your pathway. Okay, so I believe our SSWs, they come to us in January. But so you come to us in September or January, and then you'll do basically almost a full year. And what will happen is that we will offer you support to become prepared for your work integrated learning placement. But the thing is that we also offer an early start option. So if you come to us through Pathway and you're already employed, and your employer is supportive of you going back to school, which I'm fairly certain that they will be, you're actually able to use your work experience as your field experience to put towards your degree. And so for those people who are already employed, instead of waiting until the summer, we allow you to start collecting those hours in January. Okay, so that's our work integrated learning course. That's how many hours it is. We really do try and support students in ensuring that they have the right placement for them. And what's also interesting about the work integrated learning placement is that it can be paid or unpaid. And in the Bachelor of Child and Youth Care, and I'm sure that Julie and Akil also experience this, one of the conversations we have with our students is, listen, you can get yourself a paid placement, but that means that you already have the skill set. And so if you're actually looking to build your skill set, we would like to help you seek out opportunities that might be unpaid. So in child and youth care, some of those opportunities might look like clinical hospital settings, day treatment settings, private or public school boards, settings for kids with autism or developmental disabilities, a lot of day treatment, a lot of day therapy, those kinds of settings. They're not necessarily paying. And what we really try and stress to our students is that unpaid placements are for opportunities for emerging skill sets, and that is why you're here.